Hey everybody, we're going to try and do a succinct tutorial on breast implants, shape versus round, silicone versus saline. So let's start with silicone. Silicone implants, they're all really kind of gummy bear implants. Whether they're shaped or round, they're all gummy bear. It just means that the gel is really cohesive, means that if you get a hole in the implant, the silicone just doesn't spill everywhere. It's more of a gel. And I'll show you this example of a cut implant that we have that if we squeeze it, you can see the gel come out, but if I release it, it all goes back in. It doesn't just spill all over the floor, just like a gummy bear. If you cut a gummy bear, like a piece of candy in half, it doesn't leak everywhere, it keeps its shape. So gummy bear implants, all silicone implants are gummy bear implants now. They keep their shape. This is a round implant. You can see it's round. And with the round implant, you put it in, it might spin a little bit, no problem, it's still round. This is a particularly high profile implant. This is an ultra high profile implant from Mentor. It's one of the brands. There's low profile, moderate profile, high profile, and ultra high profile. You just see it's got a really nice amount of projection. So that's a round, high profile, ultra high profile silicone gel implant. This is a shaped implant. You can see that it's got a little bit more fullness down here. That gives you a more natural look. It is silicone. It is a gummy bear still, just a shape. So there's less fullness up top, so it looks more natural. So people come in saying they want a natural breast, but then when you tell them that they won't have that fullness up top with a shaped implant, then they want to go to the more rounded implant, which isn't as natural, even though that's what they thought they wanted was natural. But anyway, this is a shaped implant, and we put this in, we got to make sure the pocket's just really tight fitting so that it doesn't spin, because again, if it's a round implant, it spins, no problem. If this spins, you've got a sideways boob. The reason these are textured is just to help kind of keep them in position so that they don't spin. Texturing has been associated with something called anaplastic large cell lymphoma. It's not like your typical type of cancer. It's mostly if you get the scar tissue around your implant, which everybody does, but then like maybe 2 years later, you all of a sudden get a bunch of fluid collecting around the implant. That could be the scar tissue, could be a type of lymphoma. Again, not your typical straightforward type of cancer, but anyway, you go in and cut out that scar tissue, you pretty much cure the patient. That's not really an issue with smooth implants. So if you are getting a shaped implant, you should be aware of it, but the risk of that is extraordinarily low. If a family member of mine wanted a shaped implant, I'd be okay putting that in them, because I'm not really worried about them getting ALCL, anaplastic large cell lymphoma, because it's just not that common. And it's like, if you want to say it's common with any type of implant, it's a particular brand that I don't even use. So like I said, really low risk. Round implant, silicone, shaped implant, silicone. We showed you the silicone gel. Now we can talk about saline. Saline's not as exciting to show you because they kind of come deflated. You put this in, you blow it up, it blows up sort of like a balloon. Saline implants, they are less expensive, but they just don't feel as natural compared to silicone. And they sometimes have more of the rippling on the sides with saline implants. Now a really cool type of saline implant that you should be aware of is called the ideal implant. This is saline, but the outer shell, which is silicone, just like regular saline implants, the outer shell is silicone. But with the ideal implant, there's multiple shells inside that are also silicone. The whole thing's filled with saline, but because there's multiple shells of silicone, if you put this under a napkin or something like that, and you squeeze it, it actually feels more like a silicone than you'd expect. So it still feels like a silicone implant, even though it's not, doesn't have the silicone gel. So if you're worried about silicone for any reason, even though there hasn't been enough statistical evidence in a study to show that silicone implants cause connective tissue diseases like lupus and things like that, or breast implant associated illness. Not saying that people don't feel like they're experiencing these types of illnesses, but there's just not enough evidence showing that it really does exist in patients that are getting implants all the time. That if you are worried about those silicone issues, then you can get an ideal implant or a saline implant. The benefit of the ideal implant is it feels more like silicone without the silicone. So wanted to make sure we went over everything, talked about the good, the bad, and the ugly, talked about breast implant associated illness, which is people having like this kind of malaise and just very nondescript illnesses. I'm not saying they don't have it, but it's just hard to detect, it's hard to diagnose. Whereas with ALCL, anaplastic large cell lymphoma, there's a certain fluid, if you do get that excess fluid around your breast implant 2 years after the augmentation, you can send that fluid off, and there's a very specific diagnostic test to determine whether you have ALCL or not. And if you do, then you can go in and cut out that scar tissue and you're pretty much cured. So hopefully that was helpful. If you have any questions, send us a message, comment below, and we'll be happy to get back to you.